Welcome everyone to the Ontario Caregiver Organization's webinar series. These webinars bring together caregivers and subject matter experts to explore topics of interest to caregivers. We do this to support and engage chosen family, friends, neighbors, really anyone who's caring for someone else. My name is Katie Muirhead, and I'm going to be your moderator for today. We begin this gathering by acknowledging the Indigenous peoples of all the lands that we're on today. And while we meet on a virtual platform with people joining us from across the province, I'd like to take a moment to acknowledge the importance of the land we each call home. The land that I'm standing on is the traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples, and acknowledging this reminds us that our great standard of living is directly related to the resources and friendships of Indigenous peoples. As team members, we are learning about the lands from which we work and exploring how we can be meaningful allies and how we can support the recommendations from the Truth and Reconciliation Commission. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our understanding of local Indigenous peoples and their cultures. We invite you to take a moment to reflect on the land where you are, and if you're not familiar with that, we'll be sharing an interactive map which tells you which traditional territory your city or town sits on, and you can find that at native-land.ca. Our webinar today is called How to Provide Support to People Having Surgery. People undergoing surgery will need support for all stages of care. If you're supporting someone who's having surgery, it's important to know about preoperative patient care, the surgery process, and postoperative care for the prevention of surgical site infections. Today's session will review the Ontario Health Quality Standards for surgical site infections, the role that healthcare providers play to prevent surgical site infections, and offer some information on who to contact if there's concerns about wound healing. And we have two speakers joining us today. We have Dr. Claudia Malik, who's a pediatric plastic surgeon. Dr. Malik is the current Vice Chair of Quality and Patient Safety for the Department of Surgery and an Associate Professor at the University of Ottawa. And with her, we have Megan Graham, who works as a patient partner with the Surgical Quality and Patient Safety Committee at the Ottawa Hospital. Megan is a lived experience advisor and patient advocate. So thank you both for joining us today. And I'm going to invite Megan to kick things off for us.
Good afternoon, everyone, and thank you so much for your time today. I appreciate the opportunity to share my journey through one of my two surgical site infections and the impacts it had to me, my family, my health, and my recovery. So I've had rheumatoid arthritis for over 30 years. I was diagnosed with juvenile rheumatoid arthritis when I was 16. And I've been my own health advocate since my diagnosis, and the experience I speak about will come from this lens. So rheumatoid arthritis wreaked havoc on both of my shoulders so extensively that I was a candidate for 2 shoulder replacements in my early 30s. My first replacement went well, and it was a full replacement of my left shoulder joint. A year later, we looked at tackling my right shoulder, and this is where my surgical site infection story begins. In total, I've had 11 shoulder surgeries, and so I'll be skipping over a few as I chat about them today. But the first one on my right side went well, and a few years later, the pain returned, and we had a few more surgeries to repair, replace, and bolster the hardware and my joint so that it could be a functional joint for me. By October 2014, I was on my 3rd surgery on my right shoulder. And the plan was to take some bone from my hip and put it in my shoulder to hopefully make a better joint. Surgery went well, and 4 months later, I was scheduled for an arthroscopic procedure to remove a few screws, and that had been pre-planned, so there was no surprises there. Leading up to the surgery, I was asymptomatic. I didn't have a fever or chills, no temperature, minimal pain, no warmth or redness or irritation around the surgical site. I was, however, a patient with rheumatoid arthritis, having been on immunosuppressant medication for over 25 years. It was my fourth surgery in as many years, and my surgeon and I were well aware of the elevated risk that I had. I took every precaution we knew at the time, which was primarily showering and scrubbing with chlorhexidine sponges, wearing clean clothes to bed, waking up, repeating the procedure, and heading into the hospital. It was about 10 days post-op that my surgeon called me at home and shared the devastating news that I had a surgical site infection from the October surgery about 4 months ago, and that having a surgical site infection on a replaced joint means I needed a PICC line with IV antibiotics for 4 to 8 weeks. I needed another surgery to remove my current joint hardware and put in a cement spacer, and then another surgery 4 to 6 months down the road to insert my joint hardware, and oral antibiotics for months and possibly years. Having a surgical site infection for me was a turning point. The call with my surgeon is one of those 5 or 6 moments that I remember with such clarity on my healthcare journey. I went from being able to manage my health independently to actually having control being taken away from me and not being able to be as independent as I liked. My independence was no longer my own, and that really impacted myself and my family. Sometimes my family calls me stubborn, and I like to do things myself even when I shouldn't. So even after my PICC line was inserted and I started my IV antibiotics, I asked my community care nurses to teach me how to hook, unhook, and flush my PICC line myself. I wanted to be able to do this independently. When I had another surgery about a month later, I had a sling in one arm and a PICC line in the other arm. And so my husband learned actually how to administer my medication each day through my PICC line, as I was only one-handed. My children were young at the time, and the whole family laughs and remembers about my PICC line IV medication being hung on a wire hanger on one of the lights in the family room while we waited for it to drip in for 30 minutes. It wasn't a very laughable situation, but I think that's how we managed to get through it as a family. But that is definitely what a surgical site infection looked like for my family and some of the challenges that we faced. Surgical site infections take a toll on your life, your family. They can endanger and potentially limit future healthcare choices and options. In the end, my infection cleared, my shoulder was replaced, and I'm not on long-term antibiotics. But this is not a period in my life I wish to repeat, which motivated me to work with the Surgical Site Infection Health Quality Ontario Committee and provide a patient voice to the standards. So were I to have surgery today, I think the risk factors that we'll be speaking about shortly in quality statement number 1 would have led to a higher focus on my preoperative patient care, which is in quality statement number 2, and a focus on my perioperative monitoring, which is quality statement number 4, and possibly looking at prophylactic antibiotics, which is covered in quality statement number 3. I hope that furthering education on the surgical site infection quality standards can help health patients, caregivers, healthcare professionals, and anyone else in the healthcare system reduce the number of surgical site infections. Any impact we can make on improving the statistics around surgical site infections would improve the quality of life for patients across Ontario. So I thank you for your time, and we are over to Dr. Malik to talk us through the quality standard.
Hi, good morning, good afternoon, everyone. Depends from where you're calling. So as Megan mentioned, the Ontario Health developed the surgical site infection quality standards. Next slide, please. And that's what we would like to talk today. So part of the presentation will be what are quality standards, why we develop it for surgical site infection, and what are questions that you as a patient or as a caregiver, you can ask the surgeons when a surgery is provided as an option for a condition that you have. So the quality standards, they are aiming to help the patients, the families and caregivers, but also they are aiming to help the healthcare professionals to know what to offer, what is the evidence, the organizations, and also the province as well to know that we provide a high quality care across the province. Next slide, please. So when we develop quality standard resources, we develop it for patients. So we have a patient guide. We develop the standards, how to start it, how to measure it. And we provide also a placemat, and the links will be provided to you on the email, but that is the link that we have for the surgical site infection. Next slide, please. So when you look at the quality standard, you need to have few quality statements with some adequate definitions of some terms that we have there. What is the audience statement? And also, if you want to implement any of those standards at your institution, what indicators you should look for and to measure to see if you were successful or not. Next one. So today we will focus on the surgical site infection at the patient guide, and is designed for patients, families, and caregivers to understand a bit better how to look after patients with that they had surgery, and if they will have a surgical site infection, how to identify it, and what can be prevented or treated with. So why do we need quality standards for surgical site infection? Is we have over 500,000 surgical procedures done in Ontario for each year. And when we're looking for surgical site infection, most of them, over 90%, they occur at the primary care setting, so not in the hospitals. Next one. So patients, what they do, they are coming through emergency department, and 63% of the hospitalizations for a surgical site infections came from ED, but some of them, they are going through the clinics and they are admitted straight to the hospital. And surgical site infection is responsible for half of the admissions that they are coming through the ED. Next slide, please. So when we're looking for the patient, they are coming through at the emergency department, 20% of them, they will end up with a hospital admission related to a surgical site infection. But half of the visits, they are triaged as high acuity that needs to be seen urgent, but then there are also discharged home. Next slide, please. So what is the population that is coming to, that has the highest rate of ED visits? So it's the population between 18 and 44 years of age. But when we're looking at admissions, after they were assessed in emergency department, the highest rate of hospitalizations is for patients and people 65 years old, 65 years and older, and affects somehow more females than the males. Next one. The lowest rate for admissions was between 18 to 44 years of age. That is the population group. Next one. So sometimes when surgery happened, the surgical ones require sometimes dressings or a bit more care than other procedures. And then a home care transition plan needs to be in place. And this varies from region to region and is not standardized. In the Surgical Site Infection Quality Standard Advisory Committee, we had Megan, but also we had Cheryl as lived experience advisors. And that was her code with regard to the Surgical Site Infection Quality Standard. She wants to bring a conversation with your surgeon or with your relative that has surgery to explain to them what they can do to prevent a surgical site infection, how to look for signs for surgical site infection, and what will happen if you have a surgical site infection. Next slide. So we will go through the statements that we have to improve the care with regard to the surgical site infection. And those standards are for people who had a procedure that involves a cut through the skin. And it can be anywhere to any hospitals and premises across Ontario and Canada-wise as well. So we had developed 7 topics, and that is from starting straight from the office where he had a meeting with the surgeon, where he's explaining that one option for treating your condition will be to have surgery, till when you're arriving home and how after the surgery and how you can coordinate care from there. So all of us, we are different, and some of us, we have a higher risk for surgeries than others. And it's important to ask your surgeon, what are your risks with regards to the surgery? What are the risks of developing infections? And is there any of my medical conditions that may be a risk factor for that? And how my health status can contribute to this? And is there anything that I can do to reduce those risks? So those are questions that we can ask our surgeons. Also, you can ask them with regards, is there any extra care that I need to take on the day of surgery or the day before the surgery? Like having a bath or a shower or a sponge bath, depending on the physical limitations and current living situation. If the surgeon should provide me extra help with certain shower products that we can use. And if I will need to reduce the risk by having a nasal decolonization process, which is either with a cream, just to reduce the load of bacteria that we have it normally in our nose and on the skin as well. Also, you need to ask if antibiotics will be given before and after the surgery or during the surgery. Not all the conditions and not all surgical procedures require antibiotics before or during the surgery or after the surgery. So there are certain ones that they have a higher risk of infection. They will have those antibiotics prescribed, and there are well-defined guidelines for that. Then during the surgery, we monitor your temperature and oxygen level, and this is standardized across all surgical institutions. And next slide. And we are trying to operate with the team that will minimize the transfer of any bacteria or viruses or anything during the procedures by having as sterile equipment as possible, and certain measures and policies are in place to reduce the traffic in and out of the operating room as well. When we're looking from the education perspective, questions that you can ask your surgeon either before the surgery or when your loved one just recovered from surgery is, do you have any information about the surgery on the website? If it is written, depends on what your preference is. How long it will be the recovery, how will be the recovery in general, if I'll have a lot of pain or not. What are the signs that I can look for if an infection might develop, and who do I contact for this? If I can have a shower on when, if I can have a bath and when can I return to my normal activities? Also, surgery, it is depends on the extent of the surgery and how complex it is. Sometimes Tylenol and Advil should be enough, but depends on the allergies that your loved one has. But you need to ask what kind of painkillers you need to take, if there will be a prescription for it. And with regards to the surgical wound, do I need to take the dressings down? How do I look after my surgical wound? Do I need nurses to come in to do my dressings? Will I need physiotherapy after surgery? Do I need to buy any equipment, or do I need to be provided with equipment or splints at home after surgery in order to have a good recovery? So those are all the questions that you can ask your surgeon about it. And I think those was the last topics that we developed the quality standards for surgical site infection. Thank you very much.
Thank you so much, Dr. Malik and Megan, for taking some time to join us today and sharing the standards. And it certainly gives us a lot to think about. And Megan, for sharing your story. It's not easy to share your personal experiences in front of many people. So we thank you for your time. Now we have time for questions. We have lots of time for questions now. So if folks in the audience do have any questions or comments they'd like to ask or share, please feel free to put that into the chat box. This was really interesting for me, as I'll share with everyone as well. I've had some pretty significant surgeries in my time, and not once did I think about surgical site infection. My mind immediately goes to recovery. When can I go back to normal? And I don't really think about those really important steps that lead you to that place. So this has really got my brain going. And so I want to thank you both for that. Megan, you talked in your when you were sharing your story about your family sort of making jokes about a really difficult situation. And I think that's a common theme for family caregivers. When they're faced with really challenging situations, we make the most out of difficult things, and sometimes we find humor in the most uncomfortable or difficult spaces. So thanks for sharing that. I'm wondering if you have any advice on how to approach a healthcare provider. We shared at the end some of the postoperative pieces, and I think those are questions that a lot of caregivers would have. But do you have any tips or advice on how to approach a healthcare provider around worries about surgical site infection? Like, is there specific wording that you would use or strategies that you would take? Megan, I'll start with you.
Sure. One tip I've always found helpful is to always bring a list to your specialist appointments. I always bring a list of questions. My physician usually smiles, nods, but generally appreciates the fact that I've come prepared and I've thought through a list of what my questions are. And so I think understanding what your risk factors are, and even just asking that question to the surgeon, like, do I have any risk factors? Should I be concerned? And is there anything I can do beforehand? Sometimes, there is some pre-optimization you can do before surgery that may or may not help out with a surgical site infection. It may help with your surgery outcomes overall. But I think the patient guide for the quality standard is actually well written and easy to digest and understand. And so that was done on purpose. It was written in more common language than medical language. And I think that there's some good information in there. Everyone's situation is different. I think educating yourself as a caregiver, and just even if you say, to the physician or surgeon, do I have any risk factors? Is there anything I should be worried about? Is there anything I can do? I think those are good places to start, and some pretty common questions.
Thank you. Dr. Malik, do you have anything to add to that?
No, I think I appreciate when patients are coming to me with a list with a list of questions. And it's part of the description when I describe surgery. I said is always that there are some risks, and that there is you need to be aware what those risks are. Open-handed questions, even sometimes you have anxious parents and caregivers. That's important to explain to them and to take your time to explain to them what are the possible consequences. Some surgeries are more complex than the other ones, and there are different types of questions that you need to have for that discussion.
Mm-hmm. It is really unique to your situation and the surgery you're having and your own health condition. So I can appreciate starting out with that list and making it custom to you and your surgery and your specialist. And that's a really great starting point. We had a sort of a comment and a question in the chat around transition planning home. And I think this is a challenge for a lot of us as caregivers. We're not doctors. We've never done this before. And depending on the nature of surgery, sometimes there's a lot of wound care and surgical site care that you need to provide. And the question is really around what if we don't feel confident in doing this? What if this is so outside of our scope? We're not really sure what to do. Do we have any control over like education around managing the wound care and timing of bringing a person home? Sometimes it feels very rushed, especially if it's an unexpected surgery that's happening and the transition to home happens really quickly. So I'm wondering if you, either of you, Dr. Malik, you're unmuted. I'll start with you. If you have any thoughts on that transition planning home and the level of support and education, or if there are community-based resources that are available that caregivers can lean on when they're maybe not confident in doing the care themselves.
Thank you for the question. I think firstly, all those worries needs to be expressed to the surgeons, and maybe if the answer is still the same, well, we have to discharge, and there are a lot of pressures on the healthcare system, which I understand. But also they have to think laterally. Can we do a home assessment earlier before the surgery? And then maybe we can identify those points, and when we can make the recovery way more smoother, and it's helping the family caregivers with whatever they need. So the community can help. They have some resources, but it needs to be triggered from the hospital saying the surgery is coming. How can we improve, and how we can evaluate to see is anything needs to be in place before patients is arriving home.
Great, thank you. Megan, do you have anything you want to add to that?
One thing I found helpful is when I was getting discharged, I generally wanted someone there with me getting my post-discharge instructions, right? You're just coming out of surgery, you're probably not quite with it, you're stressed, your physical health is probably not optimal. And so having someone else listen to either the physician, the nurse, whoever at the hospital is discharging you, and providing you with home care instructions specifically about the wound. The other thing I've noticed, at least at the Ottawa Hospital, which is where I'm a patient partner with, and that's where I've had my surgeries, is over time it went from oral to written instructions. And I had a copy written down that I was taking home with me. So even if you don't remember in the moment, you can refer back to something that's written down. And I think also having a second set of ears there to hear the discharge instructions is really important.
Yeah, it's great if you can to bring some support along with you as a patient, most definitely, but as a caregiver, even to have somebody also there to hear the instructions and understand the next steps. Dr. Malik, you mentioned the home assessment. Can you elaborate on what that is a little bit more? I think what I understood from your comment was that it's triggered by the professionals at the hospital and it's done by someone in the community. Is that through home and community care support services? Is that specific to each community? And is there language that caregivers can ask their medical professionals as part of those questions when they go in preoperatively to say, these are my concerns, who would they flag for that?
Yeah, so it depends on each how the systems are set up. But with regards the meeting with the surgeons, you will say, I want to know how mobile my patient, my loved one will be. And if they say, well, it's not much, and you'll say, well, I may have some medical condition that does not allow me, or I don't have the force to lift him or her up to move her from one place to another. And I says, I feel that the recovery will not be smoothly, and I would like to have the home evaluated, or to help me to have the home evaluated, to have some community support in place before discharge, because the discharge, when somebody is admitted in the hospital, at one point when they are discharged home, they should have a meeting with the caregivers and to say, is it safe for your loved one to be discharged home? And sometimes those are delays on discharge because if they have a visit at home, they may find that is not fit for the loved one to come back home. So from that perspective, I think if you start the process a bit earlier, I think either you will not have a delayed discharge, or things will be in place and there will be less stress on the caregivers.
So if we can have those conversations as early as possible, and it's sometimes difficult for some caregivers, but advocating for your needs and being very clear with your surgeons and the medical professionals involved that there are concerns, but may also be limitations based on your physical ability or your home setup. For some people, their homes aren't modified and they're not, how do we get someone through doorways or into rooms or into a bed and things like that. So I would think that if we could write all those worries down and set some time with your surgeon and those discharge planners at the hospital that you're having surgery at, for the person that answered those questions, or ask those questions rather, you could maybe get some more clear answers in your own community. Let's see, we got a couple more questions that's popped in. So what are the process for accessing community support? So once that patient has been home and discharged home, are there community-based supports that are available, and how would people go through that process?
Yeah, so it varies from region to region, but what I will suggest that when the patient is discharged, that's why is that those packages or transition to home packages where the situation is evaluated and says, right, you will need a wound care nurse. And that's why I said, will I need a wound care nurse? Will I need this? And sometimes you trigger kind of an idea on the surgeon's mind. He says, yeah, that's a good idea. Let's start it from now, or I think you should contact them well before in advance, or if you need any equipment related to the wound or non-related to the wound, like splints or other things like a Zimmer frame.
Hmm. Will I need a wound care nurse? There's a good statement question to put on your list to bring in when you meet with your surgeons. We had a question here around more and more same-day surgeries in non-hospital settings. Has this influenced infection and follow-up protocols? So maybe Dr. Malik, that's for you.
No, so the way that when we move from the inpatients to outpatients, most of the hospitals, they will do a trial of a certain group of patients, or they find the fittest patients that they can return in the same day, they will go, and then slowly they expand. So the follow-up and the surgical site infection is pretty much the same if they would have stayed in hospital, but is much more efficient. And some of our patients prefer to sleep on their own bed at night rather than sleeping on a hospital bed. So it's a balance of the two, and I think having that for fitter patients, day surgery is the ideal solution.
Great, thank you. Megan, I'm going to ask you this next question and see if you have any hacks or tips for folks on the call. We had a question about where's the best place to get some of these medical supplies, like the gauzes and creams and gloves and that sort of thing. I'm wondering if your family found any hacks or great places in community to find that type of equipment.
Yeah, and I've often had the hospital where I had my surgery did not provide the chlorhexidine sponges, and so I had to go purchase those myself. So I've always gone to Shoppers Home Health, and I certainly I'm not getting paid by them or anything along those lines, but I just think sometimes explaining to them what you need and asking for help. And then other times I've just gone to I've gone to the pharmacy, or my husband's gone to the pharmacy and explained the type of wound or dressing we needed. And the pharmacists have been able to help. And I'm sure that's at any pharmacy across the province. So ask for help, I think, is kind of my suggestion. Don't wander the aisles aimlessly, and let them know what you're looking for. And this is assuming it's not specialty equipment. I have actually been discharged with instructions and supplies because the shoulder wound I had was quite large, and I don't know where I would have gotten a bandage that large. And so they discharged it with me with instructions as to when to change, how to change, and gave me the supplies to do it. So that was very helpful. So maybe again, as you're being discharged, ask, when does this need to be changed? Where can I buy the supplies? Is that something the hospital could supply to me, just to make the discharge process a little bit easier? And when you go to change the wound, you have the appropriate size bandage for whatever size your wound is. So asking for the supplies is also an idea.
Great tips. Yes, this is not a sponsored webinar. We are not sponsored by Shoppers Home Health, but we know those are readily available in our communities. And I love that you emphasize the use of the pharmacy and the pharmacists. They can be such a phenomenal community resource. And as caregivers, we don't always ask for help. We do tend to, I know I'm guilty of it, wander and try to do it ourselves. So asking our pharmacists, asking those surgeons and medical professionals as we're discharged. And maybe it's another great pre-operative question as well. And we like to be prepared. Caregivers like to have everything set up and ready to go. So what sorts of things am I going to need at home when my loved one comes home? And do I have the right sizes and shapes and equipment is going to really help us manage some of our stress, I'm sure. Gonna ask another question. We talked a little bit about risk factors. It was in the standards, and Megan, you referred to it a bit in your talk as well. And I think sometimes we don't all understand maybe how those risk factors can play a part in wound care and healing and surgical site infection. So how might someone ensure that they know what their risk factors are and be very clear in communicating that to their healthcare team? Maybe I'll ask Dr. Malik to get us started on that.
Okay, so there are certain conditions, medical conditions that makes you a bit more prone for it. So having diabetes, having disease that they lower your immune system, those ones they will be that they will increase your risk of surgical site infection. Also, the type of surgery that you have, if it is just a surgery to take a bump out from a hand, to extend that if you have a surgery on something is wrong inside the tummy and you need to do something, an abdominal surgery. So there are different type of wounds and different type of structures that you are involved during the surgery. But if you have a list of all your medical conditions and all your medications, that's what you should bring with you at the appointment with the surgeon. It says, right, this is all my medications and these are all my medical conditions. Do you think any of those will impact on the surgical site infection, the rate that I have? That because all of us, we have a risk, but that risk is quite minimum, but certain conditions will push that risk sometimes 2 or 3-fold.
Very important. Thank you. I think sometimes especially if we're living with a chronic condition, it's just part of who we are, and we maybe forget that this is going to have an impact. I don't know, Megan, if you had anything you wanted to add to that question.
Again, the only other thing I would say is, and I'm speaking specifically from the Ottawa Hospital, but I think it's common in hospitals across the province, is there are electronic health records. And as patients, you can see what's in there, you can update it. If your caregiver has access, they can look in and see what's listed in there. And so I always make sure that everything that's going on in my healthcare life is in there. It's updated from any meetings I have with my physicians and surgeons. So I'm an advocate for electronic healthcare records. That might not be what everyone's comfortable with, but certainly making sure everything's updated in there is also helpful. And again, writing down questions before meetings, I can't emphasize that one enough. And starting your list a week or 2 out, right? You'll have random moments in the grocery store or driving in the car where you'll think of questions. And I personally keep mine on my phone. That way, anytime I have a question, I just jot it down in my notes section, and that's what I bring into my appointment. But I think being well prepared for your meetings is some of the best advice I think that's helped me out. So you don't walk out of the appointment and 5 minutes later on the drive home think, oh, I wish I had asked about whatever the question is. So I think being well prepared is important.
Great tips, fabulous tips. And I know that we will be sharing out this recording along with all of the standards that Dr. Malik reviewed. And so if you're listening today and or watching the recording down the line and you think, I'm not really sure what questions reviewing some of those standards and going through some of those links will maybe prompt you to think about things that maybe you wouldn't think about, and you don't want to have that, 1 a.m. wake up call where you go, oh no, I didn't ask this and the surgery is happening. So I would encourage folks to please read through those standards and read through those questions and things to consider and think about, because it will help you sort of formulate all those questions for your specialists and your doctors before and after surgery. We have a question on, can a session be provided on how to access and utilize electronic health records? That's a great question, Heather. I'm not sure that we're in a place to do that at this point, just because that's something that's really specific to community. Not every hospital, doctor, specialist, surgeon utilizes those. But happy to reflect on that and think a little bit more about how we might be able to provide some information from OCO to caregivers on medical records, because it's not standardized across Ontario just yet, or maybe ever. We're not really sure. Are there any other questions or comments from our audience? We've had some really great thoughts that have come through. And as they say, lots of information is going to, I'm just looking through the chat here. Lots of information is going to be coming your way after our talk today. I don't see any additional questions. If there are things that we missed or things that you'd like to ask, you can also call our helpline or reach out to us afterwards, and we'll do our best to answer any questions. So I do want to thank you, Dr. Malik and Megan, for joining us today and providing such phenomenal information, really wonderful, clear standards and great tips and strategies for our caregivers. So I'm going to thank you for joining us, and thanks to everyone for taking time out of their days to join us to get some great information.